Now you can see my lovely husband's face. This next video is going to talk about what I call guitar player pain. Now that is relatively global to whichever arm they use more. I don't even know what the other arm is called when you play the strings, but
fretting hand, picking hand.
There you go. So he's going to tell you briefly where he feels his pain, and then I will give you a brief description from a clinical perspective, and then I'll show you a couple tools that may be used to address that pain and dysfunction. So the fretting hand, where are you feeling pain?
I'm noticing a lot of pain along the pinky side of my forearm right here.
Okay. What movements are you having problems with?
If I rotate inward, it tends to hurt a little bit right here.
Okay. So different parts of the body that are involved with that. Of course, you want to think about the kinetic chain going from fingertip all the way to back, even to hip. But for now, I'm going to show you the shorter version of the chain. Now, pain here, this is typically where your wrist flexors come in. So, of course, that makes sense if you're reaching for the strings this way. The wrist flexors go all the way from fingertip to the medial or inside of the arm. Now, you have a lot of different structures in your hand, wrist, and forearm. One is the retinaculum, so something, it's like a band that goes over all of the tendons and ligaments, carpal bones of the wrist. You also have two large bones in your forearm, the radius and the ulna. In his case, it's the ulnar side that is a little bit more infected. As for wrist bones, the ulna goes with the radius down here towards the wrist, but it also articulates with a disc, which then articulates with the lunate and the triquetrum, which can be, if they're causing some dysfunction, may prevent you from fully supinating, even if your supinator muscle is up here. So without knowing a specific cause or having any kind of radiologic images, it's really hard for me to pinpoint exactly what's wrong. I can pinpoint that his ulna is sitting a little bit funny. Now that could be coming from a lot of things coming up the chain, but we're gonna do an experiment. So right now, go ahead and supinate. So I can see he's a little bit restricted, and he comes a little bit from the shoulder outwards, externally rotates to get more supination. So his true supination is not quite there. You can notice this isn't flat. What I'm going to address using a few different tools is the dysfunction between the distal ulnar joints, but then also those of the wrist flexors. Now, afterwards, we'll see if there's a difference or if you folks can see a difference. So again, I'm going to take my lovely emollient, spread it on like butter. While we're talking, the fascia that's in here, they have an interosseous membrane between the ulna and the radius, can become dysfunctional if it's not allowed to move the way that it should. So that's also something that you can address. Now, after he has plenty of emollient on, I'm just going to scrape just gently, just to see what I feel. And again, I automatically see some redness, which is typically an indication that something's going on. So just gently scraping up wrist flexors optimally all the way up to their attachment and past it. Now I can tell you, I feel that stucco again. What do you feel when I do this?
Same thing, yeah.
Same thing. So if you have pain here, where it can develop also is here in the medial epicondyle, also called medial epicondylitis or golfer's elbow. Some of the same movements that a guitar player has. I would also use this handy dandy tool that we saw earlier to address this area where there's an ulnar ligament that kind of brings the lunate and the ulna together. So you can see this side has one bevel, this side has two bevels. If I want to go back and forth, then I should use the two bevel side. If I want to just go in one direction, one bevel side's fine. Now, personally, I feel crunchiness even just here. Why am I going right here? Because in order to supinate, that ulna needs to move a little bit smoothly. So that could be some of the problem. I would come from hand into the wrist and forearm instead of just addressing this spot alone as well. Now, if I wanted to get a little bit deeper, this toy, I can go right deep in between the radius and the ulna, kind of targeting that interosseous membrane I was discussing earlier. If I wanted to address extensors and flexors, which is not a bad idea to do both, there's another multi-tool that's a little bit larger because he's got some big muscle for being a strong man. I would probably go for the bigger of the two, and I could go up the kinetic chain. He again is a passive recipient. If he wanted to be a little bit more active, what he could do is while I'm treating, he could punch out. Okay. Or if I wanted to mimic the activity of him playing his guitar, I could have him grab a pipe or some kind of a cylindrical tool to squeeze and come back while I'm treating, which could benefit mocking the actual stuff that he's doing on a daily basis. Afterwards, you'll see again he has a little bit of redness. If I was to do a full treatment, he may have a little bit more benefit, but normally you only need a few minutes, 2 to 8 I'd say, to do an entire kinetic chain. So just that little bit, I'm noticing there's a little bit more laxity here. And there's a lot less soft tissue dysfunction that I can feel. Now, I know that was only a few minutes, but we did a longer treatment the other day. What did you feel after we did the treatment when I went up the kinetic chain?
I noticed a lot more mobility and movement. I could move it a lot more.
Which is good. And the pain, did you have pain when you played guitar?
I did, yeah. There was actually a lot of pain in my wrist, and after you did it, a lot of the pain went away, almost all of it. It was amazing.
So what's really cool is you don't have to have a traumatic injury for IASTM to be applicable. You can have inflammation that's caused by repetitive movement, such as by playing guitar or other things that can also be addressed. So you can mention these things as clinicians to your patients, or patients mention these things to your clinician when you're seeking treatment.